It's another episode of Unplugged. This is the only show that brings you raw, real, and inspiring stories from all walks of life. You don't get to say no. You need to tune into KT. Yes, and you can find us on Facebook and on YouTube at KTV_official. KTV_official. When you go, you share the link to your friend and tell them that Unplugged is on. Today is going to be a very interesting episode. We are going to touch on a very sensitive issue in society. Before that, let me acknowledge my sponsors. We are proudly sponsored by Rev Asante, home away. You can find us on in Cape Coast, Second Ridge, opposite the Infancy School Gate, or you can call us in the numbers on the screen. And of course, Christmas Tales and Park, where great food and unforgettable moments come together. You can find us at the Starlet 91 in Cape Coast, Sudu, or you can call us on the numbers on the screen. My name is Rama Walden, and of course, I am the queen of the show. We're going to have an amazing discussion, but before that, go for a quick break, come back, and still at one here. Please stay with us.
Royal Hotel, richly inviting, comfortably yours.
Step into a world of flavors and stories at Whisper's Tales Pub and Restaurant. Whether you are here for a hearty meal, a refreshing drink, or just good company, we've got something special for everyone. From our sizzling dishes to our handcrafted cocktails, every bite and every sip is an experience. We're open throughout the week with both local and continental dishes like acheke, fufu, all rice dishes, our signature point and kale catfish, and many more. Unwind in our welcoming atmosphere, perfect for catching up with friends and creating new memories. Locate us at the Starlet 91 Road, Sudu, Cape Coast, or call 055-8000-040. Come taste the tales we whisper at Whisper's Tales, where great food and unforgettable moments come together.
You're welcome back. If you just tuned in, this is Unplugged. Before the break, I said we're going to have an amazing discussion. I'm here with an amazing gentleman. He is a lecturer at the Department of Education and Psychology at the University of Cape Coast. He is Dr. Dereck Oppong. And today we are going to talk about psychological treatment in Ghana, the risks, opportunities, and solutions. Yes, please stay tuned. Doc, good evening.
Thank you so much for having me.
It's a pleasure. How are you doing?
By God's grace, I'm doing well.
You look good.
Thank you. And thank you also for the lovely scenery you have here.
Yeah, it's a pleasure. So, Doc, let's get straight into the conversation. Currently, what is the state of psychological treatment in Ghana? Mental health issues and drugs. What is the current state of psychological treatment so far as Ghana is concerned?
Thank you. So, there's been a lot of improvement over the past few years, but let me start like this. So, when you compare mental health to, if you like, orthodox and other regular systems of medicine, mental health is still quite young. And that's global. So even in the most advanced of countries, there is still a lot of work that is going on. But I would say that over the past few years, Ghana, we've done very, very well. I think at the time, especially in the areas of psychiatry, in the areas of clinical psychology, in the areas of clinical health psychology, community mental health, even public health. And all of these are various, fields that fall within the spectrum of what mental health covers. And I think we have done well so far, but there is still a lot of work to be done, primarily because, back in the day, a lot of mental health challenges in Ghana were largely attributed to, superstitious and traditional models. So, we are highly religious, highly spiritual people. So the first thing that we tend to do when somebody's diagnosed with a problem and we don't understand is that we attribute it to, spiritual causes. And so people still, struggle with accepting mental health challenges as what they are. And so for that matter, there's a lot going on. And yes, so people still, prefer, or if you like, the first point of call when people have mental health challenges. We go to all sorts of spiritual sources, for help. We seek all kinds of spiritual explanations for help. And so we are not there yet. The other challenge also has to do with the fact that there are not enough mental health workers available, within the system. I am a clinical psychologist, and I know, for instance, that there's not a lot of us to go around. And there are yet still even fewer psychiatrists in the system. And this becomes a problem because when you look at where mental health is heading towards now globally, back in the day, we used to have psychiatry, or if you like, mental health treated as a separate thing. That is why, for instance, Ghana, we had psychiatric facilities. And you notice that in Ghana, all our three main psychiatric facilities are down south. You have Ankafo here in Cape Coast, you have Accra Psychiatric Hospital, and I think the youngest, is the Pantine Psychiatric Hospital. These are the three major facilities, but these days the focus is on decentralizing mental health care, and that's where everywhere around the world now we are going towards. So what that means is we treat it like almost every other form of mental illness. So every major hospital is supposed to have that unit, but we are far behind.
What is being done to help this? Because it's a challenge. Every hospital is supposed to get a mental health unit, but that is not the case. So what can be done about this?
There are several things that need to be done. So the first thing is we need to start training enough people, okay? And like I said, mental health, I didn't even talk about, for instance, social workers, all right, who are another very major, player in the equation. So the first thing we need to do is we need to start training enough mental health workers. And like I've said, we're talking psychiatrists, psychologists, social workers, community mental health workers, and even mental health advocates. First, we have to train them. Second, we have to be able to retain them. Then third, we also have to start putting in the infrastructure to make sure that they are able to work, in the various settings. There's outright, if you like, pure psychiatry, for want of a better word, where basically that's what most people think about when they hear about mental health. That's what people picture. But beyond that, the setup, the layout for most mental health facilities calls for a little bit of privacy. it calls for a little bit of confidentiality. So you really, we don't play, if you like, within the public space, as again, because of the stigma, So all these things have to be put in place. Train the people, provide them with the equipment, provide them with the setup that they need so that we can provide that setup. And let me quickly add this, and it's not just in the hospitals. It should even be in the various workplaces. And thankfully, at least we have quite a few forward-thinking organizations now in the system that have actually started integrating mental health support for their workers. And that has gone a long way, to helping employee welfare, even to help productivity, and so on and so forth. So, yes, that is it. We need to make them available, and then we need to be able to send them to places where they are needed. So that's where we are now.
When you were speaking, you said you have few psychiatrists and few psychologists. What is the cause? Is it from the orientation? Is it why? Because most want to be medical doctors, but how come we have very few? What could possibly be the reason for this?
Okay. It's complex. So, first of all, back in the day, it wasn't as popular. For example, when you're talking about psychiatry, back in the day, it wasn't as popular as other branches of medicine. And in many ways, it still isn't. I mean, talk to any medical doctor, go to any medical training school in the country, and they'll tell you that without a doubt, the most popular branch of psychology, of medicine everybody wants to go to is obstetrics and gynecology. Don't ask me why. All right. Even men and women are like, that's where everybody wants to go to. If you start thinking of other areas like pediatrics, and so on and so forth. So really, psychiatry is not, for most people, the first branch of psychology that they want to, of medicine that they want to go into. And I think it has to do with, number one, the stigma attached to it. I remember many years ago when I started training, one day my young niece came to me and goes, "Uncle, stop the job you're doing, okay? Otherwise, one day you become like your patients." I'm like, "Hey, who told you that?" So there is that stigma, and it affects even the people who want to go into it. That is the first area. So number one is that it used to be relatively unpopular, at least speaking for psychiatry. But the field of psychology, I think over the past few years, there is an increase in its popularity. Unfortunately, there are not enough institutions that train people, for instance, for clinical psychology. I think there are only 2 universities in the whole country where somebody can train to be a clinical psychologist. That's the University of Ghana and the University of Cape Coast. I don't know if there are, I know UHAS, University of Health and Allied Sciences, is about thinking of mounting such a program. So that will be the third. I don't know if there is another place, and I will stand to be corrected if there is. So it means then that even the opportunities for training are highly limited. And for clinical psychology in particular, it's actually a graduate program, all right? So that means that you first of all have to get your first degree in psychology before you can come and do it at the basic minimum is a master's. And the training can be quite intensive. And because we don't have enough facilities to train, it means then that we can only pick a handful at a time and train them as best as we can before we let them out. Again, because we deal with people's minds for a living, you have to be very, very careful within the training setup. Make sure that the person is well trained before you set them out. Otherwise, they may end up creating a bigger mess. So there are not enough training schools around for courses like clinical psychology. But there's an increasing number, I think, for community mental health nursing and other such programs. But I think the largest reason has been, first of all, traditionally it was unpopular. Secondly, there were not enough training facilities. Thirdly, there's still a bit of stigma attached to it. And then I think some may also argue that the money is not that good. You know, there are those who make that argument that maybe compared to other career options, there may be other career options that are far more lucrative. So, yeah.
It's getting really interesting here. But let's go for a quick breather. When we come back, please stay with us.
Music bed. Music bed.
Ridge Royal Hotel, richly inviting, comfortably yours.
Step into a world of flavors and stories at Whisper's Tales Pub and Restaurant. Whether you are here for a hearty meal, a refreshing drink, or just good company, we've got something special for everyone. From our sizzling dishes to our handcrafted cocktails, every bite and every sip is an experience. We're open throughout the week with both local and continental dishes like acheke, fufu, all rice dishes, our signature point and kill catfish, and many more. Unwind in our welcoming atmosphere, perfect for catching up with friends and creating new memories. Locate us at the Starlet 91 Road, Sudu, Cape Coast, or call 055-8000-040. Come taste the tales we whisper at Whisper's Tales, where great food and unforgettable moments come together.
Unplugged here on Cape TV. Remember that you can find us on Facebook and on YouTube at Cape TV _official. Cape TV _official. Before the break, we were having an amazing conversation with Dr. Dereck Oppong from the University of Cape Coast, Department of Education and Psychology. So, Doc, we were saying that we are talking about stigma. Now, how does this stigma affect people's willingness to seek treatment when they realize they have a challenge psychologically?
I think stigma is the greatest reason why I think most people refuse to seek treatment. Okay, so number one is for most, well not most, for certain type of psychological, psychiatric problems, what may often happen is that the person may lack what we call insight. So in other words, the person may start having a psychological problem. Everybody sees it, all right? Everybody sees it, but nobody really seems to be aware. Okay, everybody sees it, but then the sufferer may not necessarily be aware that this is what is happening to him, all right? And so for that reason, you can talk to him. Problems like, for instance, paranoid disorders. And paranoid disorder is where the individual has issues with trust. And so even the person telling him or her that you have a problem, they don't trust you. So why should they believe you? You understand? So that is where you have a first problem. Then also there's the issue of stigma. You know, there's this proverb in Akan that obi a waboda ma yasane yare ekokra dodibe hwe rankwala de you know. So in other words, Psychological disorders can never be fully treated. So that stigma means then that if anybody has even the slightest of breakdowns, they don't want it to be seen. All right? And so that's what stigma does. So most people who have psychological problems avoid it, being seen in the public eye. So for instance, with the Ghanaian space, all the time we call it high fever, jaundice. We have all kinds of names
Yeah.
that we give to it. So stigma is the biggest problem. Okay, and that is the greatest problem. And what it also means, therefore, is let me also say this: it's not exclusive to Ghana or Africa.
Okay.
Everywhere around the world, mental health challenges are things that nobody really enjoys talking about. Sometimes, sadly, until it's too late. You understand?
Yes.
So that is why, for most mental health practitioners, we take confidentiality very, very seriously. And then beyond that as well, even like I said earlier, even the layout of where we see our cases, all right, and so on and so forth, is done in such a way that the person avoids the stigma. You understand? Or the person doesn't feel stigmatized coming in for the help that they may need. So definitely, stigma is the biggest challenge that people would suffer. And they suffer it, and it comes in several ways. For instance, the fear that people have even after they've recovered. Fear from their communities, fear from their family. Nobody wants to go near them. Nobody wants to eat from the same bowl with them, and all of that. So most people, even when they have had a problem and they recover, they generally don't want it to be seen because of the stigma. And I think the stigma is driven by the fact that a lot of people do not understand what goes. A lot of people do not understand what goes into mental health, and so for that matter, they get treated badly. And so sometimes it actually closes even future doors for them. You understand? So most of the time, people decide to keep it to themselves, all right? Or, just stay away from it until sometimes it's too late or until sometimes things get even worse. But the sad truth of the matter is most of these challenges can be better handled, can be better managed.
So, Doc, is it indeed the case that mental health issues cannot be totally treated? Is it true?
They can.
Okay.
They can. So let me put it like this. If you were to get malaria today, what would you do? You go to the hospital, right? And you're going to get treated, right?
Yes.
They'll put you on some medication. Does that mean that you'll never get malaria again?
Yeah.
Exactly. You get it? So why then is it that we feel that if somebody has, let's say, a breakdown of depression, or somebody has a psychotic episode, or a brief psychotic episode, call it what you will, the person suffers this thing, and then they get treated, and then they are fine. Why is it such a big deal if a couple of months or years later it happens again? We don't stigmatize people, okay, when they have had malaria 4 or 5 times in a year. You understand? But if somebody has a breakdown, if somebody has a psychotic episode once or twice in a year, then it means that that person is incurable.
Doc, it's like people expect that total recovery.
When you say total recovery, what do you mean?
They don't expect any kind of relapse. So when it comes again, it's like, if I can't yet, kind of.
And that's, I hear what you're saying. I hear what you're saying. But that is what I'm also saying, that, let me put it in three. Nipa na yari.
Yes.
Nipa yari nso yesa na yari.
Yes.
And not just saying baby. People fall sick.
Okay.
And they have the right to fall sick. And, sickness is everywhere. It can come from anything. The food we eat the places we slept, the people we met, even the air that we breathe.
Yes.
You understand? And when it comes, we will respond to it. And the person will get better. And when they get better, they will live their lives.
Yes.
And it may come again.
Okay.
You understand? I mean, name any sickness, with the exception of maybe things like the the childhood killer diseases. I understand, what do you call it, chicken pox or something that you're only supposed to get once in your
Lifetime,
or
yeah.
something. Yeah. But with the exception of some of these very rare diseases, name it: jaundice, malaria, tuberculosis, what? Cholera. Okay? You get it, we treat you, you get on with your life again, it comes again, we treat you, you get on with your life.
Okay. So we should understand that it could be the same case with mental health issues.
Yes.
Okay.
And so, I mean, you can marry, for instance, somebody who has had, might have had one or two episodes, maybe at some point in their life, maybe just before they met you, and the person tells you, "Oh, so this is it. Oh, and I'm on this. This is a condition I'm dealing with." Let me ask you: would you, for instance, refuse a marriage proposal, for instance, because the person has asthma?
No.
You understand? But the person is on their inhaler. So everywhere they go, they have their inhaler in their bag every now and then. I mean, Hamatan is coming, and you're going to see people jogging, and every now and then they stop to take a puff. Why then do we think that if somebody has a previous psychotic history, or maybe they are even on some medications, and this is where it gets interesting, all they have to do, all right, is stick to their medications, and they can live a normal life. Now, let me say this, otherwise I may be accused of oversimplifying the problem. Now, what used to happen back in the day was a lot of what we call first generation antipsychotic medications were very, very unpopular because of some of the associated side effects, that most of them carried. But like I said, the field is young globally. So now, new advances are being made, better and better medications. I mean, think of any illness, HIV. Back in the day, it was some super scary thing, all right? But advances are being made. But it's the stigma that is the killer.
Yes.
All right? So once the person understands that this is the problem, and this is what I have to do to make sure that the problem doesn't happen, that's it. They can get on with their life. But the problem is where somebody hears, "Oh, like I said, oh, once upon a time, I had cholera." Okay, that's fine. Once upon a time, I had measles. No problem. Once upon a time, I had tuberculosis. Cool. Oh, once upon a time, I had schizophrenia. Yeah.
Yes.
Or once upon a time, I had a psychotic breakdown, or I had a bout of depression, or I attempted suicide. Yes, that was once upon a time. How are you dealing with it? And that's it, you're fine. All right?
Okay.
Think of high blood pressure. I don't think having high blood pressure stops anybody from doing anything. It's the same. So the real problem here is the stigma and the lack of understanding.
The real problem here is the stigma and the lack of understanding. I like how the show is going. Let's go for a quick break. When we come back, we get into more for you. Please stay with us.
Music bed.
Ridge Royal Hotel, richly inviting, comfortably yours.
Step into a world of flavors and stories at Whisper's Tales Pub and Restaurant. Whether you are here for a hearty meal, a refreshing drink, or just good company, we've got something special for everyone. From our sizzling dishes to our handcrafted cocktails, every bite and every sip is an experience. We're open throughout the week with both local and continental dishes like acheke, fufu, all rice dishes, our signature point and kill catfish, and many more. Unwind in our welcoming atmosphere, perfect for catching up with friends and creating new memories. Locate us at the Starlet 91 Road, Sudu, Cape Coast, or call 055-8000-040. Come taste the tales we whisper at Whisper's Tales, where great food and unforgettable moments come together.
You're welcome back. You're watching Unplugged here on Cape TV. You can find us on Facebook and on YouTube at Cape TV_official. Big thanks to Whisper's Tales and Ridge Royal Hotel for sponsoring the show. So I've been joined on the show with an amazing gentleman. He is Pastor David Asante from Maranatha World Outreach, Cape Coast. And he is going to take us into the spiritual side of what we're talking about. Pastor, welcome.
Thank you very much.
How are you doing?
By grace, I'm fine. Yourself?
I'm great.
Okay.
It's good to have you here. So we are talking about psychological treatment here in Ghana, the race solutions and problems. But I want to get into the spiritual aspect. You deal with a lot of people because of the nature of it. When a member comes through the challenge, how are you able to tell them, baby, and when people ask you, we need to go and see a psychiatrist and a psychologist. How are you able to tell?
Okay, so thank you very much. It depends on the situation the person brings. Yeah, sometimes as you continue with the questioning, you realize that what a person is going through is as a result of perhaps loss, grief, stress, disappointment, and all that. So when you realize, okay, this is something that can be dealt with by professionals, you refer the person. Yes. However, in the course of questioning, you realize that this is as a result of some spiritual orchestrations, then you handle it yourself as a man of God.
So you have conditions where that's different of both spiritual and psychological?
Possibly. Recently, I handled a situation like that. The lady just left home for the house yesterday. Yes. The issue was that her father died when she was about 6 years. And then, though she was that young, at least she could still recognize the father's face. And throughout her studies, even till this point, normally when she's walking, she sees someone pass, just a glimpse of the father. And when it happens like that, she begins to bleed. It naturally or physically, she begins to bleed. She shivers and all that, and that causes a lot of trauma. Is that okay? So, looking at the number of years it's taken, because 6 years and now she's around 21 years. So that's a run of about 15 years. So this could be a blend. So what I did was to give her the spiritual direction of what to do in order not to see that. And then, though she's not yet been to the counselors, she will go back. They are on break now, so she will come back in January, and then we follow through the counseling. I wouldn't say, no, because of what I showed her to do, she's, for the past 2-3 weeks, she's not been seeing such things again, which is for the first 2 weeks in her life since it began. Because normally within 2-3 days, she should see something, even at the lecture theater. So sometimes, and her friends have confirmed that she normally screams. Her roommate, in fact, has been a wonderful friend, because she normally does that in the middle of the night. She can scream, and then the roommate would have to wake up and calm her down. So, in as much as we gave her direction, she followed through, and for the past 2-3 weeks, she's not seen it. We still think that she needs to see a counselor to take her through, some kind of, to undo that which has happened over the period of 15 years. Yes.
So you see, in our environments, the first place they go to is the spiritual side. This is the man of God to be. They don't even consider whether it's a purely psychological issue or spiritual. But the first thing, it's like, I don't know if it's from our orientation or whatever. The first thing is that they feel naturally it's a spiritual issue. As a man of God, how do you educate your viewers, our viewers on that?
All right. So first, we should realize that the lack of access to mental health facilities, is slow. So if I am in a church, and I think the first point of contact, or one that I'm quite close to, is the pastor. Whether my situation is, normal in this sense of physical or spiritual, I think I have to go to the pastor. So it is rather the pastors who should take it upon themselves. Once they realize, this situation is not really spiritual, then they can refer such members to professionals who can deal with that. But for the members themselves, except, as we said, our orientation, it is not everybody that has had access to, schooling or education that will realize that, what I'm going through is stress, is this. So I need to go and see a professional. No. For majority of our local people, what they will do is go to whoever, is a spiritual leader, whether traditional or, first of all, to seek help before they are able to be referred to professionals.
Now, let me come to you. Let's talk about the costs involved in seeking mental health treatment. Let's say I'm being surrounded by so many issues. Deep down, I feel I need help. I need to see a psychologist. Now, I contact the psychologist and he says that a session is less than 300 cedis. And depending on the severity of your condition, you may have maybe 2 or 3 sessions a week. I'm sure if I had that amount of money, I wouldn't even be facing the challenge psychologically. Now, I need help, but I don't have the money. What's the balance? What are we doing about that? But there are so many people out there who need help, who need to see a counselor, therapist, but they don't have the means. So, what?
That's the Gordian knot of mental health. Okay, so the first good thing now is I think the government actually, I think, announced, the outgoing government, during the latter part, that they were going to make psychiatric care. They're actually going to put it on the NHIS. So what that means is that now, at least when you go in there, depending on the hospital, if there are professionals available, you can access them. But even before that, and let me also emphasize, when you go to the government facilities, most of the medications, for example, that are given to people with psychiatric, psychological disorders, are actually heavily subsidized. Yes, it's one of the most heavily subsidized medications on the system. But now I think the government is actually making moves to just absorb 100% of the fee. But it's going to come at a cost. The cost is that, like we've already agreed, and Pastor, thank you so much for reiterating that point, is that there are not enough of us to go around. So, but where they are available within the, within the hospital space, you can have access to them. There are also a few that are also into private practice. And then also, they are perhaps the most expensive. But then again, universality of choice. Some people, for example, I'm a lecturer, but I'm also into private practice. Number one, the rules do not allow me to hold 2 full-time jobs like that. And then also there are a certain, if you like, select clientele who are prepared to have access to that confidential, exclusive service. They also have the right to have that. Then, of course, services are available within the public health. And then what we are also trying to do is we're also trying to make mental health available. That's why, like I said, we have community mental health nurses. We train people, for example, who are specializing in various aspects, at least as an early intervention system, all right, to at least be able to provide some level of care to people who may be having some of these problems. So it's when it gets really serious that perhaps psychiatrists, clinical psychologists, clinical neuropsychologists may also get involved. Yeah, so we are trying to, bring it down to the level of the people. But it's not easy because there are just not enough of us to go around. You realize I haven't been able to answer your question directly because there's no simple answer to it. One of the biggest ironies of mental health care is that the people who need the help the most are the people who can't afford it.
That's true.
That's just the side, and it's the same everywhere around the world. When you go to Europe and all, you see homeless people, people who have been kicked out of their homes because they couldn't pay rent or other things. And you think that they are lazy. No, it's because they are having psychological problems that have rendered them dysfunctional. So they are unable to take care of themselves, even to afford bills. And they are the ones who we call homeless. So it's not exclusive to Ghana.
That is indeed a very sensitive one. So, is a therapist the same as a psychologist?
All right. Let me say, we have, in the mental health space, we have different types. Okay, so let me start like this. You have what we call, for instance, peer counselors. All right. Peer counselors, anybody at all, you can be trained, for instance, to become a peer counselor in, say, substance abuse. Or you might become trained as a peer counselor, let's say a youth counselor on HIV and human sexuality. Just some basic training of a few weeks. All right. I don't want to say they're at the bottom of the rung, but that's one of the most common. Then beyond that, you have guidance and counseling specialists, who you might probably sometimes find in schools and other places providing career. Then we now have counseling psychologists. All right. Counseling psychologists are psychologists who, they are the ones people often call counselors. All right. So they normally deal with issues of, if you like, a more psychosocial issue. So day-to-day problems with life that people may be going through, marital problems, relationship problems, youth problems, problems with life, and so on and so forth.
It's amazing. But, Pastor, let's go to you. These days on social media, and then you see very, very young people committing suicide, attempting suicide, or depression and everything. It's becoming very rampant. From your perspective as a spiritual leader, what do you think would be the cause of these rampant, young, very, very young people attempting suicide and that kind of thing?
Well, for the causes, I think that there are many causes. There are many causes. I think 2 years ago or so, Ghana was ranked, is it the third most stressful country in Africa. So there could be many causes. The pressure, social pressure, is too high. And these days, where young people, everybody is looking for means to make it. Because money has become the new order. If you are looking for authority, power, then it must come through money. So everybody is looking for money. And so some of the things that go into getting money causes some of these things. And also, as Doc rightly said, there could be factors, it could be health factors that could lead people into. Recently, we lost a gospel musician.
Yeah.
Yes, because from from the informations we gathered, he was going through some health issues. He had been through about 2 or 3 surgeries and all that. So that had a toll, on his mental health, and could lead to that. He just gave himself up to a person. So there are many factors, but chief among them could be health, and could be the pressure to make it.
Pressure to make it among young
Yeah, among young people.
Can I also add something very quickly to that? And Pastor has set the tone on a very, very deep issue. There are many issues, but at the bottom of it is lack of support. You see, so stress, you're right, financial problems. We live in an extremely materialistic time.
Yes.
You have to have the latest phone, wear the latest clothes, be able to change your clothes every Sunday, have the latest car, So we have complicated life for ourselves. And no money, no friend. You understand? So you have all of these things coming together, and at the bottom of it is when somebody is going through a difficult time, who can they talk to? That's at the end of the day, for me, I think this is where it boils down to. When you can see somebody, you can see somebody who has everything. He has it all. She has it all. Popular, wealthy, has everything. But when you are alone in the room and there's something going on, is there anybody who can just hold your hand and say, it's going to be okay? In fact, is there somebody who you can run to? And I think that that's one of the biggest problems, you understand? And I like what you said about, and these days there are a whole lot of illnesses and diseases. Somebody contracts them, and then the stigma, they'll rather die with it, you understand? And then leave people to speculate than than live with the shame, and so on and so forth. And there's something we have to learn from other advanced countries. Sometimes an individual has a problem, and the first day they meet you, if they're going to be with you for a while, they tell you, I have to tell you, I have this particular problem. So anytime I begin to do A, B, C, D, this is what you have to do. And when you know it, like, oh, okay, that's it.
Yes.
And there's no stigma. But here, you tell the person, oh, Charlie, hey, me wa asthma, and today be making sure somebody me inhaler. The next time you call the person, you get it. So these are things that we need to start addressing as a people. How to look out for each other. We are quick to run away and abandon people when times get tough. It's very sad.
We are wrapping up, but Pastor, let me come to you. How do you make yourself a safe place for your members, your sons, your daughters? Being the leader, many people look up to you because of who you are in society. How do you at least make your members feel at peace through your message? Because many people come to church for so many reasons. Most of them have a lot on their mind. They come to church. So how do you make yourself a safe place for them?
Okay, so personally, some of the things I do to make my place a safe place for others is that I am open to them, and I embrace them individually. There are certain issues that they tell me. If perhaps you are one of them, what you tell me that I know is that this thing must not go out. I don't share with the other person. So all of you can be my sons, but in a way, there's a way I deal with each and every one of you, so you don't feel given away.
Yeah.
So the secrecy, that is what some men of God, unfortunately, do not have. The things sometimes you tell them is secret, by the time you realize next Sunday is on the pulpit. They might not mention your name, but you know exactly. And when you do that, you really, it's like you are sucking the person from the church. You are driving the person away. Because, so pastor came to, perhaps there are one or two of very observant people in the church who have seen few things about such, oh, pastor is talking about this girl. And at the end of the day, you might not find such people in church again. So one of them is, keeping their information secret with me and safe with me. Then I embrace them as I'm speaking to you, one of them is just watching television in my room. He is done. He wanted to go home tomorrow, and then he passed by to say hi to me before he goes. And so they are family. I make them family. I don't lord it over them. I am anointed. I'm your priest. So, lie down for no. You have to welcome them. I am in my PhD. Most of them I minister to doing their national services, level 200, level 100, and all that. But I don't, when you come and we are together, you wouldn't realize that, there is this age difference, class difference, and all that. We are just one family. So I think that making it a safe, making your place as a pastor a safe place to be is to keep their information a secret and also to open up real well for them to feel free, comfortable to interact with you.
We're bringing our discussion to an end. So, what message do you have for your viewers regarding mental health? Any word of advice for them?
Okay, thank you. The first advice I will give to most of our Bible schools. I think that this subject is very important and it should be a course. Mental health, psychology, therapy, it should be a part of the kind of courses we take at the Bible school.
Mental health and spirituality.
Exactly. We can invite professionals to come and then teach because, once you are a man of God, as you rightly asked a question, there are people who run to you, whether or not you are a professional, they run to you first of all because they think their issue is spiritual. Yeah. So if you have such training, such background, at least you can meet them at the point of their need halfway, and if you realize that is not enough, then you can now refer them to a professional. So the first thing is that I think Bible schools should take it up and put some of these things as part of their curriculum and teach it to upcoming pastors. Yes. As well, I would advise all of us to take our mental health issues very seriously. Yes. Issues with, it can be as little as forgetting things too rampantly. You put something here and the next minute you are all over the room looking for it. That is where it begins. One remote, you just go round.
Maybe you are even holding it.
Oh, I guess, when you see things like this, I think that from that time, you should begin to see a professional who can help out with some of these issues before they become grave. Thank you.
Number one, I would recommend that we should be each other's keeper. When we see that somebody is having a problem, we shouldn't run away from them. I would support everything my brother has said. But in addition to that, when somebody, especially in this day and age of social media, when you see a friend having a particular problem of a psychological nature, you can also read up on it, get a bit of understanding about it, and then, so that you know how to help them. And then in addition to that, when you're having a problem, people need to understand that most mental health practitioners are bound by, principles of confidentiality and anonymity. So don't shy away from seeking help, especially when you need it. All right? Needing help is not a sign of weakness. And needing help does not mean that you are crazy. I have been a practicing clinician for almost 15 years now, and I tell people I don't see crazy. I haven't seen somebody you call crazy. No, you understand? So needing help doesn't mean you are crazy. Needing help is not a permanent sign, a permanent mark of forever doomed or whatever. You can get the help you need and still go on and live the rest of your life as happily as possible. And that's why we are there.
We are here for you. Thank you so much for making it to the show. It's been an amazing session. I hope you've learned. I hope you've been inspired. This is Unplugged. You get sent, but you need to tune in to keep tuning. Thanks to Whisper Stills and Red Royal Hotel for sponsoring the show. We'll see you same time next week right here. My name is Rama Walden, of course, and I'm going to be. Have a good one. Bye-bye.